If you have health insurance, you've seen your premiums rise significantly. Now, if you don't have it, there's a good chance you go without health care.
But there's a program popping up across the nation in which doctors provide free health care. Action 10's Mark Schneider joins us with more on Project Access. Mark?
Project Access started in Asheville, North Carolina in 1996 when doctors got together looking for a better way to serve the uninsured. Since then, 19 other communities across the country, large and small, have copied the program. 62-year-old Jane Hopi is one of the first people to benefit from Project Access. Like millions of Americans, she doesn't make enough money to pay for health insurance, but makes too much to get Medicaid. So when it comes to medical care,
you just do without. And that's basically what I probably would have done. Gone without, done without, until it became a serious problem.
How have things been going since I last saw you?
Dr. Suzanne Landis is among the 615 doctors in the Asheville area who treat 20 patients a year for free, keeping them out of emergency rooms where care is a lot more expensive. If Landis's patients need medicine, it's free. If they need surgery, it's free. They don't miss out on anything.
I am able to take care of them the same way I can take care of my insured patient.
I really can't put it into words. It has been phenomenal. It has been such a blessing and such a help to me personally.
Hopi goes to Dr. Landis. She had a detached retina in her left eye and says without free surgery, she would have lost her sight. Since Project Access started 7 years ago, tens of thousands of low-income, uninsured people in Asheville have benefited, getting everything from free checkups to free heart surgery. Now, before you consider moving 2 hours east, realize this program is not meant to be a lifetime free ride. In fact, some patients are on it for less than 6 months. To qualify for Project Access in Asheville, patients must have no insurance and earn less than $18,000 a year. They have to requalify every 6 months, which means people who don't belong on the program are quickly removed.
What they are looking for is help when they need it, a hand up, not a handout when we come to this kind of a program.
The president of Project Access says the program helps patients and doctors. Here's how. In almost every community, doctors already provide some charity care. This program puts a limit on the number of uninsured patients they see, while Project Access gets patients every diagnostic test, prescription drug, and medical procedure they need.
It shouldn't take an act of Congress to provide improved access and improving the health of our communities. What it takes is an act of caring.
Project Access is winning awards from healthcare organizations across the country. The doctors are largely responsible for the success.
This is the reason we went into medicine in the beginning, to enhance the social good. Somewhere along the line, we forgot about that.
It's the most important thing I've ever done in my life, and one of the proudest moments, I believe, of this community.
Asheville's Project Access went national last September. The question now, could people in Knox County benefit from Project Access? Or do we already have enough free health care for the uninsured? We'll look at that on the Night Beat. Ted and Robin.
Mark, what does it take to get Project Access started in a community?
Well, the first thing you need is doctors willing to offer the free health care. Then they need some local support from either the city, the county, the United Way perhaps, or hospitals. For instance, in Asheville, the Buncombe County Commission puts $400,000 a year into the program, which pays for administrative costs and medication. That investment resulted in $8 million in free medical care last year. Robin?
We'll see you tonight at 11. Thanks a lot, Mark. Still ahead, Todd with the rainy and now snowy forecast. A lot of you staying.
Now, Action 10 News continues.
We've gotten a lot more school closings and delays, and of course you can see that at the bottom of the screen.
Now, a program that started in Asheville, North Carolina provides the gamut of free health care for low-income, uninsured citizens.
It's called Project Access, and since it started in 1996, 19 other communities have copied the program. Question is, are leaders in Knoxville and Knox County interested?
Action 10's Mark Schneider joins us with that story. Mark?
Project Access is a program in which doctors provide a certain amount of free health care to those who can't afford it. Knoxville already has the Interfaith Health Clinic, which provides inexpensive health care, not free. Community leaders we talked to say it appears Knox County's low-income and uninsured already have access to health care, but that doesn't mean things can't improve. One of the great results of Project Access, according to the people in Asheville who started it, is the uninsured there are now more likely to report being in good health than the insured, and are less likely to go to the emergency room.
The outcomes that we have realized through Project Access over the last 6 years, and the rewards of helping other communities go through their own process of replicating and adapting the model and some of the principles that we've established here to their own circumstances, has been very renewing for our physician community and for our entire medical community.
McKenzie says he'd like to help this community too. But Knox County's Community Service Director says when you combine what the Interfaith Health Clinic offers and the Knox County Health Department, you basically already have Project Access.
So individuals are not going unserved. They're been looked after through these two programs.
Interfaith Health Clinic.
95 doctors volunteer at the Interfaith Health Clinic. Another 400 specialists see low-income uninsured patients in their offices. Patients pay what they can afford, somewhere between 10 and 30% of the cost of care. The clinic's executive director says she plans to contact the American Project Access Network to see if things they do could apply here.
There's no point in reinventing the wheel, and so if they have already been down a road that we've not been down yet and they've already crossed a bridge, then I think that's very important that we learn from that so that we don't waste our resources and our time doing that.
The Interfaith Health Clinic is in Knoxville Council member Rob Frost's district. He says it provides an incredible community service, but he likes what he's read about Project Access.
There's always room for improvement. Project Access probably could help. Perhaps, additional assistance given to what we presently have had for over 10 years.
And while Cynthia Finch says Knox County appears to be in fine shape regarding health care for the low-income uninsured, she's impressed with the way Project Access focuses on patients' attitudes toward care.
I think that any time that you have a program that has been successful in a community, it is wise for another community to look at all angles of it, to see if there are pieces of it that will be beneficial to programs that we have here in Knox County. So I think the answer is yes. We'd like to give them a call.
The East Tennessee Regional Health Office, which oversees 16 county health departments, says they're always looking at ways to improve the health of their communities and are also interested in learning more about Project Access. Ted and Robin.
Now, Mark, have any communities in Tennessee started a Project Access?
Not yet. However, Chattanooga is in the process of getting the program off the ground. Another 60 cities across the country are either trying to implement Project Access or they're at least looking into it. Ted and Robin.
All right.